IMC will train the entire office, including the dentist, to offer a well-scripted, patient-friendly 15-minute consultation. It's my belief that many times patients don't accept treatment because they're simply confused about the implant process. Using this effective consultation, we found that it greatly enhances case acceptance because the patient feels like they understand each step of the implant process and what's going on. It makes them less fearful of the procedure, and it makes the staff more confident as well.
Dr. Goodman's approach is, let's at least make our patients educated. Let's get them up to speed, and let's educate them in a way that they can understand.
When I look at what happened here, obviously it happened because Dr. Paul Goodman himself has the technical expertise to do the work. But more importantly, Paul is a really good teacher. He uses language that I can understand, anybody can understand.
You know, there was a nice thorough explanation in terms of here's why I'm doing that, here's what's involved in that, here's why this is the latest technology, the latest medicine out there.
Our motto at IMC is to help the practice understand what goes on from the first phone call to the final maintenance of the implant restoration. And we believe that each one of those steps is very critical for the patient feeling comfortable with what goes on. So that starts with a patient calling up your practice and asking, do you do dental implants? Or I'm missing a tooth, I'd like a dental implant. You need to have a staff that knows how to answer a question like that and say, Dr. Goodman does implants here all the time. We offer complimentary consultations. Once the patient will come in for the consultation, that is really the most critical part to the entire process, where we're able to sit with the patient without any of the pressures of clinical work and explain to them what they can do if they're missing a tooth, and give them all their treatment options, including not doing anything about it. Oftentimes when you take this approach, we're allowing the patient to understand all the options that are available. It's them at the end who say, I'd like to do the dental implant.
What IMC does is teaches the dentist, the assistants, the front desk staff, how to talk to the patients about the potential for replacing missing teeth with implants. Those patients who may have come to the specialist office, come to my office, feel more at ease with those treatment plans, and they feel more comfortable and seem to have already accepted the plan. And I think they're more willing to go through with the treatment.
But whether it's a simple case or a complex case, IMC is going to be by your side, explaining to you what to tell the patient at each step and training your staff to deal with it accordingly.